Today we will analyze the difference between medical reality and dramatic fiction in the second episode of the Netflix show New Amsterdam. Now we all know that TV shows make things more dramatic for audiences.
32-year-old woman collapsed with extreme shortness of breath and chest pain. Heart rate 140, respirations 34, BP 90 over 60. Took 100% O2 to keep her stats over 90.
We were at a fundraiser. Josette was accepting an award, then she just shook and fell.
You're right. Acute mitral regurgitation.
Trauma 1.
The doctors listen to her heart with their trusty stethoscopes, where they hear a hollow systolic murmur on the apex of the heart, which sounds like this. The heart surgeon concurs that it is a mitral regurgitation. The mitral valve is like a door in your heart that lets the blood flow only in one direction. But when it does not close tightly, it would be like having a leaky faucet. This leaking blood is what creates the sound you hear. After making an echo picture, they diagnosed Takotsubo cardiomyopathy.
You think Takotsubo syndrome?
Yeah.
That sounds bad.
Another name for it is broken heart syndrome. The mudslide may have caused Josette so much grief that it actually made her heart beat so hard that it tore the muscles that hold it together.
Takotsubo is a disorder of the heart where the apex of the heart balloons out, while the base, where the valves are located, contracts. This is why it's also called the octopus pot heart. Because of this ballooning, the heart can no longer pump effectively, and this causes a decrease in blood flow. This is probably the reason why this patient collapsed at the fundraiser. Also, the low blood flow is associated with heart pains, because the muscles of the heart get less oxygen. Now, can the heart actually tear? Yes, in some cases of Takotsubo it can, but this is exceedingly rare. According to a review article on Takotsubo, the patients who had a tear were on average 76 years old, while the non-tear group was 60 years of age. The patients who had a tear were all female as well. Now in the show, the lady is very young. Now the causes of Takotsubo are thought to be stress and problems with adrenaline signaling, but the exact mechanisms remain unknown.
A mudslide hit our village. So many people have died.
We are told that the village of this lady has been hit by a mudslide, which can cause significant stress. Now after they have the diagnosis, they decide to prep the patient for surgery.
May we perform a gatko?
I'm sorry, what?
It's a protection ritual. We make a cut in the skin, rub in herbs.
Oh no, that's out of the question. Any cuts to the skin can introduce infection, so.
God attaches law to me, protects me from accidents.
When they move the patient to the operating room, she becomes unstable. But after the ritual is done, she remains stable. Placebo? That's a topic for another video. But what part of this case is fiction and what part is reality? Takotsubo is a condition that is prevalent in the world, and it mostly affects postmenopausal women. The woman in this show is very young and definitely not postmenopausal, making it hard to believe that she has such a severe case of broken heart syndrome that surgery is needed. In real life, the cases are usually mild, and because it is a transient syndrome, treatment mostly consists of supportive care, where risk for blood clots, brain damage, or heart failure are prevented. So while it is accurate that a lady under a lot of stress can develop Takotsubo, it is not at all accurate that a young lady has such a severe case that she would need open heart surgery. In reality, doctors would prescribe medicines that would prevent further damage to the heart by decreasing blood pressure and heart rate. And most cases resolve in a week or two. So for any people watching this show and living with anxiety about any heart pains, rest assured that if you are young and healthy, there's not much reason for concern. Thank you for watching.